Welcome to Transforming Medical Communications, a podcast by MedComms experts. We share medical communications insights and advice from the best and brightest in the industry to find out what they're doing to push our industry forward. Here's your host, Wesley Portegies.
Welcome to another episode of Transforming Medical Communications. I'm your host, Wesley Portegies, and with me today is Claire Liu. I've known Claire for many years, and she's a very seasoned medical communications professional, currently working as a Director of Global Medical Communications at Takeda, where she specializes in rare genetics and hematology. Claire has a PharmD from Rutgers University and has experience both on the agency side and the industry, scientific publications, and medical communications. So today, Claire is here to dive into the complexities of medical communications, discuss the nuances of handling communications across different stages of product life cycles, but also to share her strategies for maintaining a consistent voice in global medical communications. Claire, it's great to have you on the show today.
Thanks for the warm welcome, Wesley. I'm really happy to be here.
So, since you have been having such an impressive career and worked at several different companies, and I understood you have been a medical writer before that in an agency as well, you must have seen many different perspectives. And I would love for our listeners to maybe hear what are three key lessons that you've learned so far during your career.
Lots of learning. I learn a lot about myself as well every year. I think if I were to choose three, that's quite difficult. But medical communications is what I'm doing now. And I think clear communications is number one. It seems very clear communications, but I think sometimes we leave things hang between, Wesley and I can have a conversation and we just make assumptions. And maybe it's the correct assumption, but I learned over time that sometimes, it's better to be really explicit and just make sure that it's voiced and the other person's truly understanding and on the same page as you. Along the same lines, maybe it's not so much replicable, but following your gut. Sometimes when it's telling you that, maybe you should follow up on that or just ask another question, that's often right. And so that's something I've learned through mistakes as well, that if your gut's telling you something, maybe you should do it or listen to it or think about it. Last but not least, something I've really fallen into, I think, definitely in the last year or so, especially as we started to talk to people about, low attention spans or not having enough time, is less is more, even for myself. If you, Wesley, give me, 10 pages versus 1 page to read, I'm going to gear towards, gravitate towards that 1 page or something with the graphic or animation instead. So I think those are the things that I've learned and trying to carry through to everything that I do.
Those are beautiful. I must say the first and the last one specifically resonate with me. Of course, following your gut feeling too, but from a more practical medical communications point of view, right? I think making assumptions and being too lengthy in our communications are two things that deserve a lot of attention right now in medical communications.
I think especially if people of science, you want to know all the details, right? Everything is interesting to you, but then you have to think about who you're talking to. And again, the fact that it's really hard to rub together a couple minutes these days for a lot of people. So less is more, honestly.
Yeah, absolutely. I guess less is more, and providing people the opportunity to delve deeper if they want to is great. But it should be more of a choice rather than needing to go through all the nitty-gritty to actually arrive at the conclusion, right? So a lot of the projects that we're working on currently in my agency, it's a lot about that. We're often having discussions about, maybe we should put the conclusions first. The so what factor, right? What does this actually mean to the HCP? What does it mean to their patients? Should they do or could they do something differently? Should probably come first. And then, all the rest of the information is still there, but it's more optional in case they're interested. And I really, really like that.
No, I was just going to give you an analogy that I've been thinking about. It's sort of like a song, right? Like a pop song or, any kind of song. It's always sometimes the hook that brings you in. So that's something that my team and I have been talking about as well, which is give the bottom line, the key takeaway, why should this matter to you first, the hook of a song, and then sort of lay out the why. Why is it, important to know, and why should you believe this? Yeah.
Yeah, absolutely. And the other thing is that when working in the industry or, on your agency side for that matter, we're so fully versed into our data and we're so excited about it. We spend probably more than 40 hours a week working on something and we know it inside out, but we shouldn't assume that our audiences are in that same situation. And for them, they probably just need to know something more practical that helps them making medical decisions. So yeah, I really like those three learning points. And I know this is also like related to something we have discussed previous times we spoke. One of the things that you mentioned is around like when you, for instance, when you launch a product and you're in pre-launch, these communications might need to be quite different when we're already on the market. So I was wondering, like, how do you look at that from your point of view? Like, how do you modulate these communications from pre-launch to launch and post?
Yeah. I think it's that, who are you talking to? When are you talking to it? Like when your opportunity comes, and also what, because what is sort of driven by data availability to some extent, right? Oftentimes pre-launch is before, phase 3 pivotal information is available. So I think let's talk about who. There's a big difference between internal stakeholders. Now, if you're tuning in from, pharmaceutical company, you've got commercial folks, access folks, medical folks, what they need to do their job. We're dividing a really big, accomplishment, let's say, or workload to prepare to share information about a new asset, let's say, or an old asset, the new indications or new data. That's a lot to do, a lot of different people externally to talk to. And in medical communications, oftentimes we get the first see of the data and we have to sort of share that information, educate our stakeholders internally. So I think it's about internally, who are we talking to, and that message and what we need to say to those folks or to share with them so that they can prepare adequately for their jobs. And ultimately, when they do talk externally, be ready and ready to respond. That's very different from how we prepare information that's really digestible for, let's say, that really busy physician. And so, pre-launch, maybe we're getting ready, to talk to, getting materials ready, getting the messaging ready, making sure that all the most common questions that physicians might want answered are sort of pre-answered. But it's also ensuring that we've done the training, we've done maybe the deep dive, which is not appropriate, like you said, Wesley, upfront to a physician who's very busy and just has never heard of the product before. Also it's working with some folks who already are fully aware of the product. They don't need the same high-level information, right? They need something deeper. And the conversation journey you're taking with them is very different. You're now sort of almost having a constructive discussion about whether or not a statement is clear, whether or not the data is clear, whether or not there's something, someone will say detracts from it. So again, it's who you're talking to, and also even within the pre-launch period, when, because you could be very early, you could be later stage, and what you're doing is very different. For products that are inline, let's say, that have been launched, that are available for patients, that's a little bit different as well. And, we already to some extent know what physicians are wondering. And that's exciting because we can then work to simplify, to more directly address, hopefully, the questions that they have, and maybe make it easier for patients to access the drug and for physicians to help those patients understand how to use the drug. Yeah, I'm not sure if I answered your question.
Yeah, you did. And also you said something that intrigued me that I would like to delve into a little bit more. I heard you say your part about the pre-launch. I heard you say some physicians might already know the product or might already know about it and don't need as much information. How do you account for these different profiles? How would you know, and how do you adapt your communications, and how do you implement this throughout an organization?
Yeah, that's a really good question. How do we know? I don't think we ever know for certain. There's different scenarios, right, and different opportunities to interact with the community. It could be small group with physicians you already have a relationship with that, you've either worked with as investigators or educational programs. So folks you already, understand their experience in the clinic, and then they also understand, what your data is, what your strategy is, etc. So those, obviously, it's much easier. You can tailor very clearly new information to them that you're able to share. Audiences such as, I don't know, if you go to a Congress and you're doing a symposia, you don't really know of the hundreds, let's say, folks who are attending your symposium, if you're that lucky, what is their knowledge level? I think it then comes down to almost a very well-educated guess based off, the community, what has come before you, what type of education has been done. And also, if you are the one that's new, what has your company done before to sort of set up the education around disease state awareness? Sometimes it's you've got to cater to many different levels of understanding, right? And that's where it's difficult if you've only got, 30 minutes or even 16 minutes, sometimes isn't even enough. Then you just have to try to find the right balance of pulling together didactic information and linking that to practical information and sort of talking about practical use of that information that is new to some, but old to others. And they're more so now working through, well, how do I use this information that I'm already aware of?
The reason I came up with this question because I was thinking about this McKinsey report and they were talking about personalized communications. How do you personalize communications, right? If you couldn't really customize it for every individual. So the option remaining is you create ways of communicating that at least it's clear for what kind of audience this is and you categorize or segment your audiences clearly. Have you done any audience segmentation strategies, or is this something you consider when you develop content?
Yes, and I think it depends on the product and, the disease area. But this is also where having a really good cross-functional team comes into play because, if you've got, let's say, the benefit of having a full-fledged cross-functional team up and running, you probably have a market insights person, or you yourself or someone close to you has done market insights and you have an understanding of, messaging. But a good understanding of the disease state and sort of attending some of these presentations, congresses, etc., keeping your hand on the pulse of, what do physicians care about? That can already sort of tell you, inform you what they care about. Is it efficacy or do they care more about safety in this case? Which do I put more emphasis on? I think, yes, we've done, positioning and sort of market insights and competitive comparativeness, landscaping, whatever you want to call it. But it doesn't always have to be that, right? It can also just be watching the literature, listening to new presentations as they come out, attending these scientific congresses to understand where's the community going, what is the topic of this current moment that everyone is wondering about.
Yeah. And how about insights? Have you ever seen situations where medical insights, really informed your content strategy?
Yeah, I think something that probably is a cornerstone is medical information requests or inquiries. And I think those can be really beneficial to understand over time trends in terms of what's changing. And also if potentially there's a particular point or question that folks are needing to know more information about. Maybe it's how do I dose in a particular patient population, or how long do I treat this patient for? And that helps us sort of think about opportunities in the future to maybe put more emphasis on that. Maybe we've made the assumption that mechanism of action is not something that this particular HCP community cares too much about. But if we get a lot of inquiries about, well, how does it work? And that can maybe allow us to pivot into addressing it and filling that gap. So yes, definitely medical information inquiries. But we've also, sometimes tried field questionnaires executed by our medical science liaison team to, in their ongoing engagements with physicians or, allied health professionals, whoever it may be, understand more clearly what their perspective is. How is it working for you? Is there anything that you don't understand, etc.? Additionally, I think a really valuable source of information is also our internal colleagues. Maybe you're not asking them to directly go to the, external stakeholder, but they themselves, through all the interactions they've had, can really be quite informative as to where they see the trends going. And I think that's something that we need to be aware of. We can't address every single thing that pops up, but definitely if there's a trend, that should inform us that action is needed.
Yeah, absolutely. So far we've been talking quite a bit about how to modulate your communications by life cycle stage and by audience segment. But then, of course, let's say we get there, you're in a global function. So I'm assuming that you're communicating through your affiliates as well. And then it's going to be important to have kind of both a consistent message, but still have the ability for your affiliates to then modulate it to what the local needs are. Could you tell us a little bit more about how you go about that?
How we go about in global ensuring that we can work closely with our affiliates on the ground?
Yeah, how do you create one consistent scientific voice across the world? Yeah.
Here, Wesley, one thing that we've really been working towards at Takeda is what we call integrated communication planning. And I think that's something that is becoming more and more of a conversation topic as well, just in the medical affairs, medical communication community, just because it's just so natural. It's something that when you hear it and you think about the concept, you're like, yeah, I should be doing it. We should be doing it. At the base of or the core of the concept of integrated communication planning, it's sharing information, understanding we're one pot. Like maybe you think of one company or one product team as a pie. We're dividing up the pie of work into many different sections, let's say, if you have the, many functions in your company. And we all have to talk to each other. I mean, that's natural, right? We have to talk to each other. We're all talking about the same thing. We're all working towards the same goal, getting product or, helping patients get access to something that can be really, beneficial for their life and how, open up new opportunities for them. However, we're so often caught up in how we are tailoring their message to the end stakeholder, but also the busyness of each day that it gets quite difficult. But we're putting an emphasis on making sure that we get the right group of people together to hear, what is each team doing for each stakeholder that we're going to deliver that end message or end piece of information. Where are the synergies? How does it all fit together in the big picture? But also in the process of doing that, sort of stress tests almost in a way what we're doing so that the regional teams can understand, they can speak for the local teams. Sometimes the local teams have a seat at the table too, and they can sort of see what are we doing. And if it's something that's not that particularly aligned, we can course correct there as well. I think we always take into account, or we try to take into account what we hear, like you said before, from market insights or directly from our affiliates who are talking to the physicians, and try to put that back into refining our messaging, our, strategy. And so we hope that through that continuous sort of feedback, what we do share with the affiliates is already quite close to, they feel comfortable and confident too, and they don't have to revise it too much more because, we are one company externally, there's so much global travel, global interchange. It's silly to think that what's said in one country stays in one. That's not true. It's shared. And so what we say in global, what we do in global needs to be absolutely aligned with what's said in local, in the affiliates. Close communication, pulling everyone together to be integrated, let's say, in one plan.
Yeah, so you're saying in terms of integrated medical communications, you integrate the different medical affairs functions or maybe beyond, but also the different geographical layers in your organization.
Yes. Obviously, you cannot touch everybody, every country, but, we do our best for where it makes sense to do so. I think it's a must. You have to.
Absolutely. Maybe pivoting to a slightly different topic. And it's more about like the different tactics that we use in medical communications. And you mentioned a few times doctors don't have time to read. We need like short form content. Can you tell us a little bit more about like anything you have been trying in that realm of short form content that you feel worked well, or maybe it didn't work at all, but like we can learn from, some of your experiences?
Yeah, absolutely. I think there's been a bit of research, even some things that have been published about sort of access towards resources and sort of even timing, how long physicians or just general readers or viewers really spend on different resources that are available to them. And it's really quite shocking. I think that's pulled through to outside of pharma and medicine as well as just everyone's attention span and ability and time that they have available to really focus on many things has shortened dramatically. But the need to draw attention and to sort of keep someone focused, oftentimes I think people immediately gravitate towards it has to be digital, has to be animated, it has to have, light music sound. But sometimes that also conflicts with resourcing, right? And how much time you have available. I love these digital resources, and I think that's where we're going. But sometimes we just don't have the time or the resource and capability to really do something that's really quite so amazing, let's say, or quite so eye-catching. So what we've really been gearing towards is, simple one-pagers, let's say, with just a couple lines of text or just a couple figures that sort of speak for themselves. And so, I think there's a psychological unlocking as well when you just get handed one sheet of paper, right? Versus 2, 3, 4, 5. Or let's say we play you a video that's only 2 minutes versus 5. I think that automatically makes someone more likely to stick through it with you, to be open to hearing what you have to say or to finish reading paper. And so, I've said this a few times already, but less is more, honestly, and bottom line first. That's what we're going towards, be it just, PPG still, one pager, short video, bottom line first. And so the other thing though, I would say, if you did have the time and the luxury to do so, we've also ventured into the realm of, mixed reality, augmented reality, virtual reality. And I will say I was very skeptical to start. I thought to myself, that's a lot of time and investment into something that you really wanted to still be short and consumable, right? Bite size. It's like, I think that really also a different way to consume information, to receive information has been really quite successful. You do have those lights out in action and you allow folks to really interact with the information that you're sharing. And that way, even though it's still, 2 minutes, 3 minutes, even 5 minutes, folks are still engaged and they hear you through, the end and hear all the detail.
Interesting. Could you tell a bit more about that? Like practically, how does a solution like that work?
Mixed reality? Yeah. Actually, my team recently created this disease education experience. It was only about 5 minutes long and it shared epidemiology, had, graphs coming up from the ground up. This was a hereditary angioedema disease state. And so we had the physician or whoever was interacting in the experience actually standing in the blood vessel, looking at, the mechanism of disease. I think just because it was also immersive and just something different, right? That automatically they wanted to sort of see where it was going. And then even if they already understood the mechanism of disease or the pathophysiology, they wanted to stay in that blood vessel for a little bit longer just to see, is there a different way that, you're going to show me this pathway that I already know? What was really cool though was my team programmed in the end, the ability for the experiencer to act as if they were a, particular treatment modality and sort of capture or interact with pathophysiology. So we had several physicians who, wanted to sort of see what would happen if I didn't act efficaciously or if I did act efficaciously. But also I think it gives people a moment to think about, what can we do in the future for patient education as well, or, student education. So in the end, you just want to have a really good conversation with the physician and hook them again and sort of get your key point across. Yeah.
First of all, that's really amazing. And thank you for sharing the example. And I think what I'm kind of getting from what you're saying is we need to pivot from talking to talking with, right? Coming back to my comment around personalized communications and our audience diagnosis or audience segmentation, and how do you know who needs to know what? There's no way to do that if you don't ask questions or understand what they actually need. And the example you just gave, in hearing how these physicians interact with it, that actually gives you a whole source of information and you give them the opportunity to explore. And I think that is really beautiful and a place where we should go as an industry. It becomes more bidirectional and not so much broadcasting information.
Yeah. And something you just said, talking with as opposed to talking to, really resonates because something that we will often talk about is we're educating physicians. They oftentimes know more than we do. They're seeing the patients day in, day out. They're doing the research, right, that we're reading about. It also doesn't feel quite right to always be didactically teaching, right? Because that's not really what they often need. In some cases, yes, they do. Or some of that audience will benefit from it. But talking with and sort of mediating or providing an opportunity for peer-to-peer engagement is also something that, we're working toward to, again, bring that practical side of clinical management to that physician that we're talking to, allowing them to hear also from their peers or acting as their peers in a sense of learning about the information that's new. So that really resonates.
Yeah. From the research I've done myself, from the research that I've seen during my tenure in medical communications, that is also the one factor that really stands out. From any HCP survey about medical communications, the thing that always comes up is interactivity. They like to talk. They like to talk with their peers. They don't like to just sit there and listen. They want to be part of the discussion. And I think that's in a way kind of what you're saying. And for us to find ways on how we can facilitate that on a large scale is a big part of how we can make medical communications way more effective and drive the impact and create those medical affairs metrics that we're all looking for to demonstrate the value of what we're actually doing. Talking about metrics, how do you look at the effectiveness of your medical communications? What tools or strategies or experience do you have in understanding if something is impactful, what to do more of, what doesn't work? Anything you can share on that?
It's a really difficult one. I think we're still working on this. I think everybody's still working on figuring out how to measure size, how to measure success or even failure I say that, there's a qualitative and the quantitative. When it's not going well, it's very clear. So I think it's more so the level of success that, and like, is it good enough that, we're still struggling to figure out what to measure, and sort of, you always want to compare, right? Because you want to know comparatively. Ideally, you want to measure, if you're doing the same thing twice, compared to prior time, am I doing better? Should I keep doing it? Should I change a little bit of how I'm doing it so maybe I can achieve better success? Or should I stop doing and pivot, do a 180? I think a lot of the things that we do in medical communications are so multifactorial. It's sort of dependent on who we're speaking to. And there's so many different stakeholders, even within the healthcare community, and how they respond. It's everybody is human. And so it could be the day when you're asking them too, that could, how they're feeling, that could impact your results. So unfortunately, we haven't cracked, let's say, the egg of qualitative measurements. But, of course, we continue to gather quantitative measurements of, number of viewers, number of attendees, in terms of digital tools, how long, folks stay on a page, how many unique visitors you have. But it all comes with the caveat of we're not entirely sure what to do with that information. Is 100 viewers good? If they stay on a page for a minute, is that good? It's hard to really, compare. It's not always like apples to apples. Sometimes it's apples to oranges, right? Every setting is a little bit different. Again, every person you're talking is a little bit different. Different types of HCPs also maybe respond differently. So everything I think does need to be taken with a grain of salt. We try to measure satisfaction as well. I think that is so very much dependent on your response rate too. And I think that is something that, I think traditionally, let's say, Wesley, right, when you do a symposium, you often do a survey at the very end of the program and ask folks these canned 5 questions of how did you find it? How would you rate from 1 to 10? How good the speaker was? Did you find this educational? Would it impact your daily practice? But what we found over time is that, maybe you hand out 50 forms, you might only get, a handful back sometimes. What we've started to do is to embed, I think this is something that lots of people are starting to do, is to embed polling questions or interaction into a program while it's still fresh in their mind to sort of keep them engaged, but also to be thought-provoking, right? And get those metrics, qualitative metrics back as to is how they're thinking about something changing. Maybe you're asking the same question a few times during the course of a program to see if that changes based on additional information you're sharing. So I think, Wesley, it's a really difficult thing. And, something I love to know if anyone has sort of started to develop, a really good sort of multifactorial rubric to measure this. That's something my team has started to think about, whether or not there's weigh certain factors, but sort of still have all these, 20, 30, 40 factors that you might want to measure program success or, project success by. Account for all these things and get some sort of comparative measure that we could use. Still working on it, haven't really broken through there, but we're thinking that maybe that's where we need to go in the future, because just measuring by one thing really doesn't give you the full picture.
Yeah, absolutely. Absolutely. Well, it actually sounds you're really on the right path there. And I subscribe to almost everything you've just said there. The onset of digital communications is really giving us so much opportunity to measure more and more meaningful metrics as well, beyond visitors, but also engagement with content. And the analytics providers in digital communications are also getting better and better. For instance, I saw this tool, which is not necessarily used in medical communications, but just generally in website optimization. It's called Hotjar. And it would basically look through people's visitors' experiences through their lens, right? So what are they looking at? Where are they engaging on the page? Which journey do they take? And it's so insightful. And there is this one little example, something that is extremely useful, and the same kind of thinking we could apply in so many different ways. But then indeed, the problem is benchmarking, right? So if you are let's say some kind of marketing agency or an e-commerce organization, when you send out your e-commerce newsletters, there are benchmarks for that. Everyone knows the industry open rate is or should be, and whether you're subpar or above par and things are going well or not. In our industry, we don't really have that, or at least we don't have that yet, right? And I think that's where we need to go as an industry, understand what are the benchmarks for these metrics. So you don't just compare against your previous attempt, because maybe the previous attempt wasn't good at all, or maybe it was great. And then either next time it's going to look like it's either great or bad. Maybe that's not really the reality that is going on. I like what you said at the end. I lost my train of thought. You mentioned something at the end about
a new type of metricization or rubric.
Well, it doesn't matter. I lost my, or come back later. But yeah, this is definitely like a big deal, the metrics.
I think so. What I was telling you focused so much on external communications, external to the company, but it's the same for internal, I think, because, same problem, right? As a physician in a clinic facing many patients, Wesley, how many emails are you fielding a day, right? Phone calls, meetings you're attending, your personal life as well. There's just so many things that are sort of competing for attention. And then there's so many communications. It's not just me sending emails, right? Wesley, you're sending emails too to maybe even the same person sometimes. And that person has to try and navigate through all these things. And so we're also becoming, need to be cognizant of email fatigue internally and announcement fatigue. And so we've started, and I don't think we've really mastered this yet or really figured out how best to use this information as well. But, looking at opening rates and how long people are spending on an email using Viva Insights, let's say, is essentially saying, okay, well, it takes me 5 minutes to read this email, which I think is critically important. Of the, 100 people I sent this to, what is the open rate? I don't know what to do with that information, but it sort of gives you a sense of whether or not it reached the people it was intended to reach, or if at least they even opened it, and whether or not you need to sort of continue to communicate that same information over and over again in the future. If it didn't get opened or read.
Yeah, you're right. You're absolutely right. And actually, my thought came back. You mentioned integrating polling questions in a satellite symposium and using that as metrics, which I think is extremely smart. And I think it's exactly the way how we can get better at collecting metrics. And I have another example for you, something that we've been doing with our clients, which is really cool. And it's similar, it's just different channel. So we developed these, we call them facilitated storytelling decks. So they're for MSLs for use in the field. We integrate questions within the deck. So it's an interactive question. So at a certain point in the deck, like there are questions embedded, and then it's a kind of nice conversation starter or engager for the MSL to have that conversation with the HCP about that particular question and kind of answer it together. But all these answers, they're centrally collected and then become an insight. And because you now can ask a consistent question and you can collect it centrally, it becomes like a source of information and in a way a metric. So I think it's exactly the same concept, just applied in a different channel. So I found it fun to hear. Thanks for sharing the insight. We're getting to the end of our recording here. So I would like to ask you maybe a closing question here. I guess reflecting on our conversation today, if there's like one major piece of advice that you could give to your colleagues around the world in medical communications, what would it be?
Maybe something that struck me recently. I think really keep your mind open. I think majority of us are open-minded, but I think be open-minded about new technologies, new ideas. Oftentimes, we're very goal-oriented people, and we know that, I have to get to point A. Well, maybe interject a little bit more fun, right? Back into, don't be afraid to do that. Interject the personal part of it back into it. Think about maybe there's something that touches the heart a little bit that you can put into the message, or how, the piece that you're creating, or how you're interacting with someone. I think obviously that should always be part of our interactions, respecting each other, being polite, but it doesn't always have to be a straight line path in all business, right? Communications is about being fun and engaging too. So keep your mind open to that, I think, Wesley.
Yeah, I like that. So like reach the brain and reach the heart.
Exactly. It stays longer in the mind.
Yeah. I really like that. Thank you so much for sharing. And thank you for being in our Transforming Medical Communications episode today. It was so much fun to talk with you, and I'm sure I'll talk to you soon.
Same.
Thank you.
Thank you.
Transforming Medical Communications is brought to you by MedComms experts. To find out more about MedComms experts and how we create some of the most cutting-edge medical communications programs anywhere in the world, visit www.medcoms-experts.com. And then make sure to search for Transforming Medical Communications in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at MedComms Experts, thanks for listening.